The cold temperatures in our extended forecast can pose serious risks to your health.
That's especially true for older adults and people with chronic health conditions. From falls to breathing problems, doctors say preparation can save lives. Fox 23's Kennedy Hobbs joins us in studio with what doctors say you need to know about people keeping vulnerable people safe in this weather. Kennedy?
Doctors say cold weather doesn't just mean discomfort. It can turn dangerous quickly for seniors, particularly those living alone or managing ongoing health issues. Freezing temperatures, icy sidewalks, and winter storms can create serious challenges for older adults. Doctors say as people age, their bodies don't regulate heat as efficiently, making them more vulnerable to hypothermia and illness. Medication safety is another concern. Most prescriptions should be kept at room temperature, while refrigerated medications like insulin depend on reliable power. Experts say seniors should check with pharmacists if medications are exposed to extreme temperatures, especially insulin or GLP-1 drugs like Ozempic.
You don't want your medication exposed. All medication comes with a preferred or recommended temperature range in which the medication is supposed to be stored or kept. So as long as there's heat in the home or adequate heat, the medication that's shelf stable or room temperature should be fine. If there's a loss of heat or something, they might want to read the bottle and check the medication, talk to their pharmacist, talk to their medical provider.
For those with asthma or other lung conditions like COPD, cold air can make breathing harder.
You want to keep the inhaler, pocket or room temperature. You don't want the inhaler freezing, for example. A frozen inhaler that freezes could be dangerous, so you would probably want to dispose of that and get a new one.
It's recommended to wear layers and protect your airways when outdoors, but doctors caution against anything that blocks vision or increases fall risk.
If you use a scarf, two things. I would say don't let it dangle down to make it a falling or tripping risk. But as long as you have the scarf wrapped so it's not going to cause any kind of slippage or tripping, that's one thing. Secondly, people can breathe through a mask or a scarf, and that's perfectly fine if that's what makes people comfortable. It does sort of like humidify the air to a certain extent. The issue is if you wear glasses, and I know this from personal experience, your glasses can fog up if you do that. And so if that happens, that can obviously impede your vision, which could make falling more of a risk. So you just have to be really cautious and careful. You might want to cover your mouth, maybe leave your nose out, that kind of a thing.
Doctors strongly recommend seasonal vaccines, including flu and pneumonia shots, to reduce the risk of serious illness during the colder months.
I strongly would encourage anyone to get an influenza vaccine or a flu shot. It doesn't give you the flu, contrary to a lot of anecdote and urban legend out there. People think I got the flu shot once and it gave me the flu. It doesn't give you the flu. You can have a mild reaction to it, but it's not going to give you the flu. In fact, it's more likely to protect you from getting influenza, which can be devastating in an older person. So influenza, yes. COVID, I think that the evidence is favorable for getting a COVID booster if you've never had the COVID series. RSV is generally considered really only for folks who have chronic respiratory illnesses, like you mentioned, asthma, COPD, or a history of any kind of lung disease or interstitial lung fibrosis, those kinds of things. They should definitely get RSV. Or anyone I would say that's ever been like intubated or hospitalized or even just had sort of garden variety pneumonia might want to consider RSV.
Doctors also recommend seniors keep extra medications on hand and ensure heating systems are properly maintained. Live in the studio covering News That Matters, Kennedy Hobbs, Fox 23 News.